Hey, everybody. How's it going? Tom, man. I totally locked up on that.
Yeah. It's like, I've been sitting here for 30 seconds in silence, which I have an excuse for, but you don't.
Maybe I'm having proximity effects.
I guess.
Let's try that again,
my crooked eyeball. And it's screwed up. I just say we roll with this.
We are, yeah.
Might as well.
I'm not sure what happened there.
Nope.
But it'll tie in beautifully to this
Vapor
episode.
lock, pal. It was vapor lock, like my VW Bug used to have back in the day.
Hey, what's up, everybody? Welcome to Basic AF. This is episode 75. This is what I tried to do, and for some reason just couldn't do it. Show notes for this episode can be found at basicafshow.com/75.
You sure about that?
I think I am. It's on the notes. I'm pretty sure that's right.
The notes. It's
Tom Anderson here, and Jeff Battersby as well. Hello, Jeff.
Good morning, Tom. How are you?
I'm not sure.
I'm not sure
rough.
either. We're going to have a nice conversation in a few moments, and I think maybe you
need to keep an eye on me for a while.
Oh.
Yeah. Jesus. Okay. So this show, we've got a little listener feedback we're going to get into here in just a second, and then we are going to review Jeff's stroke a month ago. And
6 weeks.
6 weeks at this point. And how that kind of transpired, some things that are associated with it, how the Apple Watch did and didn't do some things, and Siri did some things. So good discussion for you today.
Yeah, very good.
So that'll be good.
Hey, Ed, before we do anything, let's just post at the top. Psychokinetics show music, that little bump that you hear at the beginning. Really happy about that. And then Random Art Design for our fine show artwork.
He's on standby to maybe update the artwork, so we'll see.
Might need to update both of us. Goatee to me, and now I got one eye that looks crooked.
Right, between the two of us, we've got two good eyes. Good,
great.
Yeah,
maybe.
Excellent. So last episode, Riley Hill joined us. We talked a whole lot of iPadOS 26, the M5 iPad Pros, and we got some follow-up on Threads.
Yes, we did.
Which was great from I Am Mauricio, and we will put a link to this in the show notes, and said, on the podcast, it was mentioned that rotating the iPad messes up the screen organization. So we were talking about window management and the changes to it in iPadOS 26. He goes on to say, I just want to note that when you set up your windows in landscape view, it always stays that way. However, you also have to organize your windows in portrait view, and then those will stay that way. Once done for both landscape and portrait, they will always be organized the way you set them in both orientations, and that this works well with Stage Manager. So that was something that we were talking about, is the new windowing system. If you rotate the orientation, those things can get a little screwy. And he's got a nice video in that post to show how he set it up. So once you organize them in each orientation, they will stay that way. And so we thank you for that feedback. I am Mauricio. And something else he mentioned, Jeff, I think it was maybe in a separate, he gave us a couple of comments on that, but in the separate one, and I had noticed this too, a shortcut of sorts. If you're in an app that's in a window mode and you want to go to maybe full screen briefly and then back to window mode, you don't have to go to the traffic lights, so the red, yellow, and green. If you double tap on the top of the window, it will expand to full screen. And then likewise, if you double tap, it'll go back to window mode. So nice little
like that. I'll have
there.
To check it out. I am playing now with, believe this or not, Stage Manager and still full screen. As I said when we were talking to Riley, that's kind of my mode, just because that's the way I'm mostly doing what I'm doing. I'm watching videos or soccer. By the way, nobody that's going to listen to this is going to care, but National Women's Soccer League Championship tonight on CBS, which, for those of you listening, 2 days ago on CBS. But hey, just to say that's a thing we'll probably be doing. Yeah, right. All the news that's fit to listen to last week. But that double tap, nice little feature. And do want to point out that Riley's main complaint about that was on the 11-inch iPad, not the 13-inch. 13-inch was working fine for him, but the 11-inch was where that that finagling had to go on. And Richo, thank you very much for your input. Really appreciate it.
And something, one last bit on this, and we'll wrap this up. One of the other comments that we had during that discussion was that Apple, they brought back slide over in a sort of way. It's not the same as it was, but it is there. And then in the most recent public betas for 26.2, they have brought back split view as well. So they are kind of bringing back the things people liked again, not 100% like for like it was in iPadOS 18, but it's good that they're listening and bringing things back that people actually liked. I still wonder, did they intend to do this, or were they just totally caught off guard about how many people actually liked split view and slide over? But good to see them back. Like slide over is one of those that is handy. So
yeah, cool.
All right,
Tom. There's my voice again. Don't press on it. Laid back Jeff, and I sound pretty much the same as I did. So as you mentioned at the top of the show, 6 weeks ago, at about this time, actually it was tomorrow. Tomorrow will be 6 weeks. I had a stroke. And I thought it was important to kind of talk about this, how I knew what was going on, and what you, meaning the listener, might do if found or caught in a similar situation. And I think that's the important piece of this puzzle. The stroke is one thing, recovery from it, something else, and I'll talk a little bit about that near the end of this. But the important piece is anytime you're having some kind of medical issue or suspect you are, there are some steps you should take. So we want to talk about that, but I want to talk about the whole stroke thing. And interestingly enough, because we were supposed to record, there's a lot of text-based conversation between you and me about exactly what was taking place when, where, why, and how. So Sunday, October 12th, I sent you a message at 9:12 a.m. saying I can do 11:30 today if you want. I was supposed to play soccer. We got rained out that day. Thank God I wasn't playing soccer when I had a stroke. That would have been, I'll just use the word shitty. I was happy that I'm at home. You responded, okay, sounds good. Then at 11:22, I said, be here in a minute. And you responded with lies because by 11:30, I still had not made an appearance in our little studio. And I laughed, and then I said, dude, I'm not sure what's going on, but I am not feeling well. Need to lay down for a bit. I'm going to say right up front, if you're feeling like you're having some kind of medical issue, don't lay down for a bit. I couldn't lay down for a bit, thankfully, but going to sleep would have been a bad choice at that point in time. So you said, okay, that's no good. Yeah, go do that. And then I said, like, dizzy and wobbly, and I will just pass this little bit on and just shit my brains out. Which that's a little overstating it. Not overstating it. Sorry, that's a little graphic. But I will say, I think my body was prepping for whatever was next. Is what the deal is. So you said def no good, and that you'd OD'd on garlic and had a similar situation.
Garlic.
How
I loved you.
And that's when we decided that we were going to do the rewind episode. And I shortly after that said, let's do that. I called 911. Think I might be having a stroke. Hope not, but FYI. And you responded, oh, shit. Hope not, too. Hang in there, bro. Is anyone home with you? No, I was home alone. And I said it may not be, but better safe than sorry. And, then we said some stuff. You wanted me to let you know when EMS was here, which was good because you were really the only person at that moment that I was in contact with. My wife was at church which I was at home. And I let you know that EMS was arriving. You said, okay, good. And here's kind of the interesting thing. And this is at around, I'm just trying to see what time this was. This is all within that window of time. So sometime around 11:45, 12, was when I made that call. And then I said that EMS checked me out. No obvious external signs of stroke, but Kathy is driving me to the hospital for a full workup. And you said, okay, that's great news. Feeling any better or worse? I said the same, and I was. It was, same kind of symptoms. And then a couple hours later, you said, how are you faring? I said, well, I am in the hospital, and still, they said, doesn't look like a stroke to them yet. My BP was super high. We'll talk about that in a second. They're going to keep me overnight. They wanted to evaluate me, probably put me on blood pressure meds. CT scan was clear, awaiting an MRI. I didn't get an MRI actually until a day later. You responded, wild stuff. Glad checks are okay so far, and they're keeping an eye on you overnight. If you need to hear my soothing voice to help you feel better, you send me a podcast. Great. Thanks, Tom.
All love, bro.
Yeah. Hi, Tommy. In a regular room, I told you now I have a lot of vertigo. I had, by the way, while they were waiting to put me in the room, had a little nap. And after I woke up from that nap, I was royally screwed. I was vomiting. Actually, as a result of trying to drink some water, I could not swallow. Yeah, right. Terrifying. And so basically, gagged and tossed my cookies into a garbage can initially, and then they brought me a bag. By the way, by that time, Kathy was there with me at the hospital. And my friend Steve Cohen also came to the hospital and was hanging out with me. And he was in the room when that was taking place. I think Kathy was trying to check some other things out. But I told you that I was in a regular room, have a lot of vertigo, which is still an issue, by the way. And I'm doing okay. My voice is super weird. You can hear my voice is different now, and transition between my chest voice and my head voice is pretty screwy. But I will say that my voice change was one of the first indications to me, other than just feeling wobbly on my feet, that I was having a stroke. Then you said you'd check in with me tomorrow. Hospital still not sure whether or not I was having a stroke. I was pretty sure from the moment I called EMS that I was having a stroke, but I'll explain why maybe not in just a second. You asked me the next day how things were going. I said, I'm doing okay. Lots of testing, MRI coming soon. That was the next day. I'll have details what exactly happened then. I still don't have details. They do not know what caused my stroke. They know where it is, where it happened, but they did not have any clear indication other than my blood pressure was through the roof. But that was kind of a chicken and egg proposition. So, it could be that the stroke caused my obscenely high blood pressure. You asked me if I'm back home yet on Tuesday. I said, nope, had a stroke. I'll be in the hospital for a few days. Technically, I was there for 8 days in the main hospital. Super bad balance issues. Could not stand up. Could not swallow. And then, we went on with glad I'm starting to get back. Yeah, here I am. And you said you love me, Tom.
I do.
Yeah.
Tell you that all the time.
I know you do. So anyway, so just to kind of, that was our back and forth conversation, but kind of give you a lowdown on what it was that morning. Got up, felt pretty normal, was, going to have breakfast before I came down to record. And it was actually at breakfast that I was starting to feel a little off. And I didn't know at that point in time what it was. But there was something about, I could tell you what I had. I had waffles with peanut butter, maple syrup, and blueberries. That's what I was having. So my brain's intact. I can at least remember what I had for breakfast. But something about the meal was off, which is, I can't explain what it was, but there was something about that was a little strange. I went upstairs to grab, whatever I needed to start coming downstairs. And as I was walking up the stairs to my office, I kind of was leaning to the right-hand side, like really strangely. I was a little dizzy. And I did as one does. I Googled stuff. Don't do that. Not because it's not a good idea to Google stuff. But it's, it was, I was checking to see what are symptoms of a stroke. And I think, our tendency is to self-diagnose. One of the things I told you, I was going to lie down and take a nap. That's a stupid thing to do if you're having a stroke, by the way, because you lay down, have a nap, and you wake up super stroked out.
So at that point, when you were heading up the stairs and you were off and you said, no, I'm going to Google this and see, what made you think stroke at that point?
You know what?
Was it just an intuition, you think?
Exactly that. Okay. It was an intuition. I just did not feel myself. I've always been kind of sensitive in this way, and I mean that in kind of a standard way. Like, as long as I've driven cars, like if some little thing was off, I could feel that. When I was doing tech, well, I still am doing tech, but not at the moment, not for the last 6 weeks. There's like this sense of, okay, I think this problem is in this area. Let me troubleshoot in there. There's always been some kind of little intuition for me for those kinds of things. And that's exactly what this was. And so I went into the bathroom to kind of check myself out. And the common features of a stroke are your face is drooping, you're weak on one side of your body. There might be some kind of paralysis. And one of the things that came up in my Google search was, you could have vocal changes. And so I spoke to myself in the mirror, and my voice sounded actually similar to what it sounds like now. It got worse than this, but it was like, and it was when I spoke to myself, I looked at myself in the mirror and said, dude, you're having a stroke. I just had a sense that was the case in the moment. That was it. So some kind of intuition, and clearly knew that something was off with my body. In a way, we've all woken up with headaches. And actually, I had woken up with a little headache morning of the stroke. I took Sudafed and Advil because I thought it was sinus headache. By the way, don't do that. Sudafed, not a good thing for high blood pressure or a stroke, and neither is Advil. So neither of those things are what you want. Best choice is, and if you have it in your house, is aspirin. Just in the event that there was a clot. There was none in my case. No clot, no bleed. Who knows? Just a little piece of plaque maybe broke loose and jammed up what it was. The part of my brain that has affected me as a result of this stroke. So I actually, when I called 911, I then texted my wife, and 911 made it to my house, or EMS and the fire department made it to my house. I was standing in the doorway waiting for him to come in. I was not at that point in time in any kind of bad shape that I could tell, other than just feeling a little skewed. EMS came in. Kathy came in. She zoomed home from church, which is not far around the corner. I sat down, and they did what you would expect them to do, which is took my blood pressure, and then they did some basic tests. Look at my finger, move it back and forth. Way different than pull my finger, by the way.
A little bit.
Yeah, just a little bit. I probably could have done that too. But they tested both my legs, to see whether or not I had pressure. They had me squeeze their hands, their fingers, to see what the tension was like on both hands. And I will say that I passed all those tests without a problem, which is an important point here. We're all individuals, and in any kind of medical emergency, there are standards of how you're supposed to present if something is taking place. But because you're an individual, you may not present in the way that's expected. So in that case, trust your intuition, which for me was, I still think I'm having a stroke. My blood pressure, when they took it, was, sit down for this, 244/160.
Wow.
That's like...
What'd they say about that?
Well, they said it was high. And had they been sensible, they would have said, get your ass in the ambulance. We're going to drive you to the hospital. But because I was not presenting in any other fashion as having a stroke, they said, they said, we don't need to take you to the hospital. That's BS. They should have put me in an ambulance, no questions asked. 244/160. Kathy ended up driving me to the hospital. She was terrified the whole way, understandably. Yeah, right. And it was bad advice. Double. Yeah.
Right.
140 is high.
Right.
140 is like,
that's astronomical compare. I mean, you figure like 120/70 or something for
right. That
day
should
to day,
be
but
right. That should be.
As they double in the numbers, but not in the severity. Right?
Yeah,
I mean, it's way more than that. But
yeah, no, it's like your head could explode. That's how high my blood pressure was.
A Scanners episode. Remember that movie back in the day? Scanners, right?
Great. That would have been fun.
Thank God that didn't happen.
So I have since spoken to my mother, a nurse, my sister-in-law, a nurse, my niece, a nurse, my doctor, everybody else, and every single one of them to a person said EMS should not have said anything other to me than get your butt in the ambulance. We're taking you up. Because they're in a position to take care of me. Kathy driving me up in her car, not in a position to do jack,
right.
And nervous as it was. Anybody tells you can sign the waiver and say it's fine to go if you have blood pressure, that's honestly, I would say anything over 140, 150, screw that. You take, as my doctor said, as my GP said, you take the bus ride. You ride the bus to the hospital because they're in a position to do something. I have a heart attack. Could have, that's entirely possible. I have a seizure. Entirely possible. All those things could be a problem.
Because that's such an extreme blood pressure level. I mean, that could have triggered
crazy.
Anything.
Yeah, right. They should not have let me ride in the car. Simple. That was. They did not impress upon me the seriousness the serious nature of my blood pressure. It was like, well, you're not presenting any stroke symptoms. It just seems like a high blood pressure problem, and you should maybe
no, not a high blood pressure problem, a severely high.
Oh
blood
my
pressure,
God!
Right, we're not talking like
244 over 160.
You've got a 160. You need to do something about it. That's a little getting up there. Now this is like
this
extreme.
is through the freaking roof, right?
Yeah. That's wild.
So I will say his first mistake, and the techs in that case were not doing what they should have done. Should have been something different. That being said, I arrive at the hospital. Kathy drives me up there. I have her let me out at the door, and I walk myself in, and I am walking crooked. There's no question about it. I go wait in line at the emergency department. Come in, and I tell the woman at the desk, I think I'm having a stroke. And she, and this is a great thing about emergency departments, you get bumped to the front of the line.
Right.
So I got put in a chair. They had a crew of people come and doctors and such, and put me in a special room, hooked me up to an EKG, blood pressure still banging. But they also said they didn't think I was having a stroke because I wasn't presenting with stroke symptoms. So they hooked me up, they took me down, gave me a CAT scan, no bleeds, nothing there. And then they
give you any jokes while you were there?
I don't know. I can't remember. Jokes?
Yeah,
like what, Tom? What would be funny?
Nothing. And this is kind of my point. But when I had my kidney stone episode a couple years ago, it was right around this time, 2 or 3 years ago. I think it might be 3 at this point. So, I woke up 1 a.m, dull backache. I was like, man, that doesn't feel. This is like the medical episode, by the way, folks. So we're branching out.
Right.
But
a mostly tech podcast.
We're really stretching that mostly today. But I had a dull ache in my back. So I just got up and walked around. I was like, man, that does not feel good. And so it kind of subsided. And then I went back to bed. And then it started to really kick in. I got sick. I said every curse word under the sun. I was under the moon because it was the middle of the night. But did bond with one of our dogs at that point because he came in and checked on me. He was like, what is wrong with you? And so now to this day, if I raise my voice for anything, he comes running to check on me. So
okay, good.
That's good at least. Yeah. But, so we get up to the ER. It's about, right. We all have somebody or something. Get up to the ER.
I've got you and you've got your dog.
Great. Happy life. The guy at the front desk, I'm walking in and I'm carrying my little trash can, because I mentioned I've gotten sick a couple times. And so he's like, oh, what are you here for? I was like, I think I have a kidney stone. He goes, oof, okay. Well, sit down. He starts taking my information and he goes, first name, last name. And so I tell him, Tom Anderson. And he's like, Mr. Anderson, from the Matrix. And I'm like, dude, now ain't the time. I appreciate it, but not right now.
Yeah, right. Not funny.
But they got me in really quickly. They took great care of me. But I was like, maybe he's trying to cut the tension or something. But anyway, back to the story.
Yes. So back to the story. So anyway, no jokes that I can remember.
Okay.
My friend Steve arrives. Kathy's there. They roll me into a waiting room after the CAT scan. And the 49er game was on, so Steve and I were kind of watching the 49er game. I was tired, so I took a nap. And when I woke up from that nap, I was screwed. I had double vision, really badly. The world was spinning, had a really bad case of vertigo. Obviously could not speak, did not know it at the moment, but could not swallow. Did not know that until I asked for a drink of water and gagged and basically vomited wildly for a few minutes because I tried to take a big sip of water and could not. So really, really kind of crazy. What happened then, they had planned at that point in time to admit me, as we, read from the text messages, and to watch me overnight just to see what was going on. But at that point in time, the hospitalist came in, I don't know what her name was, but she was brilliant. She looked at me and she goes, yeah, I don't know why they're saying you don't have a stroke. I believe you've had a stroke. So that was the first indication to me that I had that. We'll jump forward from the little outline that we have to kind of the diagnosis of what it was. So I had a lateral medullary stroke, which is a brainstem stroke on the right side. And that results in something, or can result in something called Wallenberg's syndrome, which you can look it up. Plenty of information on it in all the usual places. Pretty significant, and I had virtually every single one of the symptoms of Wallenberg syndrome. So brainstem, basically your basic functionality is coming from your brainstem. Swallowing, which, you do when you're in the womb. That's, a thing that you have. Hiccups. I did not have them initially, but I did have hiccups for a few days. Thank God those went away, because when I had them, they were not fun. What I do have that's kind of related to that is, and this has gone away to some degree as well, but I noticed it while I was still in the hospital, as kind of a like catching breath that is basically involuntary. Like a hiccup is involuntary. That's involuntary. No balance, double vision. One of the things that I do have still, although it's going away, numbness on the right side of my face. Matched with temperature insensitivity on the left-hand side of my body. So, like, I'll walk outside, which I have been doing, by the way. Been trying to walk about a mile every day with a walker just to kind of get my body back in shape and do that. It feels like spring on the left-hand side of my body when it's 38 degrees outside. So, could be dangerous. I'm well aware of it, but could be dangerous. My fingers could be freezing. I don't really, like right now, and I'm pretty certain this room is not super warm, but I'm more than toasty where I am right now. Double vision, as I said before, and I still have issues with that. And all these things are exacerbated in the morning. So when I wake up in the morning, my balance is usually off. I have a good laugh at myself because I'll stand up out of bed and then on the right-hand side fall right back into it. It's expected. I expect it now, and that's getting better every day as I continue to do physical therapy and things of that nature. My voice, as you can hear, jacked up. Better at this level than it was. So I sound a lot like my previous self. But if I transition from this voice into my head voice, that transitional area is either volumeless or really, low power and, doesn't have any, basically it sounds like I'm in puberty, and I made that joke in our episode with Riley when I talk, it's like, you do it, it's like back to being 16 years old, or 15 or 14. Yeah, right. Well, with these brains, yes, right. Thank you. I'd love that. I'd love to be that age again. And I am dealing with all these things every single day right now. While I present is pretty darn good, I've been sending videos out to loved ones every single evening, about a 1-minute video, just to kind of give an update on where I am and what I'm doing. Those I look normal. I sound kind of normal. I am kind of normal, but I will tell you, this is stupid of me, but sometimes I feel normal. There's my voice. Did you hear that? Mm-hmm. Feel normal. Mm-hmm. Sometimes I feel normal. And so try to do normal things. Like I walked down the stairs the other day on the phone and with a couple things in my hand. And my right leg is a little weak. And so at least for that kind of stuff. And so when I stepped down, not holding the railing because I had crap in my hands, I started to go down the stairs. And right from the top of the stairs to the bottom of the stairs. And I, didn't see my life flash before my eyes, but I, saw paraplegic Jeff landing at the bottom of the stairs, so I intentionally, forced my head into the wall on the other side and was somehow able to catch myself. But it's like,
scary.
Yo, dumbass, hold the railing. You're not in a position to do this. And it's funny. I list right. Like if I can walk around the house without a walker, I can do all that kind of stuff. I'm cooking. I'm doing, all the stuff that I normally do. Reading's kind of a pain in the neck because of my wonky eye. But
I can see that being difficult to remember, especially on the days where you are feeling right and more back to normal, we'll say, for lack of a better way to put it.
Totally.
Because you've done it so many times.
My entire life.
It's just instinctive at this point. So I'm going down the stairs. Maybe not.
Or getting up out of the couch, and it's funny. I'll like I said, I'll laugh at myself. I'll stand up, and then it's like, oh no, and then fall right back over into the couch. And fortunately, I've got a good sense of humor about it. As I told my sister shortly after this, she was asking, how you feeling? How's your head? Where are you at? And I said, I feel fine, actually. I think the stroke, affected my brain in such a way that now I'm a sociopath. Like I have no feelings. Which maybe I was a sociopath beforehand, and this is just exacerbating that particular issue.
Well, I will say I was happy when several days had passed, and then we were back to some of our more blue humor messages that we were sent, and I was like, "Yeah, there he is."
Yep, no, so that guy's still here.
That.
That guy's still here. It's maybe worse than he ever was. So I wanted to talk a little bit about the tech of this. So I said I did a Google search. Stupid, don't do it. Don't. And the thing that I did after that was, and this was very interesting, I asked Siri what the symptoms of a stroke were. And excuse my French here, Siri was having none of my bullshit. Siri called 911. And I was like, no, I don't want to do that. I just want to know what the symptoms of a stroke are. So I can determine, Dr. Battersby, whether or not I am actually having a stroke. And,
now, assuming that was intentional, which I think it was.
Yeah, I think it is.
That's brilliant.
Absolutely. And I will tell you, the second time I did that, because I thought Siri was being Siri, same thing, dialed 911, and that kicked into my brain that I need to dial 911. That's really what solidified.
At this point, was this on your phone or your watch?
Phone.
Okay.
Yeah, it was on my phone. So I, and I will say this unequivocally. You feel like you're having some kind of medical event. Tell someone, like I told you. Also, texted Kathy, but forget Googling symptoms or taking a nap. I know it seems like super diva-y to say I called 911. But the reality is that's exactly what I needed to do.
Yes.
I needed to dial 911 and have EMS show up.
Tell you you're fine, but they showed up.
Yeah, well, that's another piece of the puzzle. So, and we're talking about their tech in this particular case. Their tech says your blood pressure's through the friggin' roof. But their training it says, well, no droopy face, no strength issues, which I do not have. It's interesting. My strength is like right leaning. That's kind of where it is. But forward, strength in my legs, all good. Strength in my hands, all good. Tracking with my eyes, even though my eyes messed up, all good. Pupil, fine. Like things that you would expect. So that is also a form of tech. Yes, it's an assessment being made by somebody that's trained to look for specific issues. But I knew I was having a stroke, and part of the tech is to listen to the patient. So I'm saying this to any of you out there who might work in the medical field, might be in EMS, might, be doing something like that. When a patient tells you that they think something's whacked, that patient should know their body well enough, trust what they have to say. And
if you're the patient, tell them everything.
Yeah, absolutely.
Right?
Don't hide anything.
Whatever. It's like,
right. You got nothing.
The more
to lose.
info, it's like, when you're
Correct.
troubleshooting anything, the more info.
Yeah, and I'm going to say that also. I'm just going to be a little political, if you want to call it this. This goes double to those of you in the medical field. This goes double for women and people of color, because the tendency is to listen less to those people. I'm a white dude, and you didn't listen to me when I said I was having a stroke, and you didn't pay attention when I had 244 over 160 blood pressure, which is, like you said,
do you have any? You don't have to get into it much if you don't want to, but blood pressure wise, do you have history with that? Or
in fact, I checked.
Oh my goodness!
After I logged into my patient portal for my GP, and my BP was 130 over. 130 over like 75 at my last physical. I was, by the way, due for a physical about now. That's when I was supposed to go for a physical next. I only get one a year.
Right.
And so the answer is no. No indication that I might have had high blood pressure. And that's, again, it's hard to know whether or not the blood pressure is, it was chicken or egg.
Right.
Whether I was having super high blood pressure because I'd had a stroke, which I think really that's what it was. But I had no history of hypertension. Some history of maybe higher cholesterol levels, which now I'm back at my GP. We got me on a different blood pressure medication, and we're kind of working on that. I'm taking aspirin, little low-dose aspirin every day to, make sure that everything stays slippery. And I will say the thing that you want to do is insist on the ambulance ride.
Yeah.
I did not know any better, but I'm telling you as listeners that you should insist, whether it's a stroke or a heart attack or something else, insist on the ambulance ride. I'm been reticent to do that. Even, there've been situations when my kids were little, like, we could drive them to the hospital. That's a dumb move. I just want to say that's there's a lot of drama in, hopping in the vehicle, lights on, sirens blaring. Go for the drama. This is the one time you could be a drama queen. You
may not be the only, but this one's okay.
Right. It is correct. So that's the big thing that I would do differently, and that I recommend that everybody do differently is, pay attention to your body, which I did, called, 911. And you've posted here in the notes a really important thing, fast warning signs of a stroke. But I will counter this by saying these are not the only warning signs. Face is drooping, arm weakness, speech difficulty, none of those things. Even now, no slurring of speech. Vocal changes. Call 911. Other stroke symptoms, numbness or weakness of face, arm, or leg, especially on one side of the body. Did not have that initially, although was crooked to the right, walking. Confusion. I mean, other than my normal confusion. At that point in time, trouble seeing in one or both eyes, trouble walking. I did have I was dizzy, had little balance issues, severe headache. I did not have a severe headache. I had what I thought was a sinus headache. So these are normal signs of a stroke, but I, as you said, knew kind of intuitively what was going on with my body, and thought I was having a stroke before really anyone thought I was having a stroke. And so I would say trust your intuition. Trust, you know your body. You've lived with it for X number of years. For me, 64, almost 65 years of living with this body. And I'm, inclined to think that any headache is a brain tumor, like everybody.
Just ask WebMD. Don't do that, by the way. Just get checked.
Call 911.
Right.
Don't. The WebMD. You're going to have all your favorite diseases. But trust your intuition and trust what you're feeling, and do not worry about being a drama queen, because you're not. I right. Unfortunately know several people who ignored, in this case, signs of heart attacks or issues like that, and who are not here to talk about it anymore.
Yeah.
And they had days or weeks of issues where they're like, nah, it's just my shoulder just hurts. I pulled my muscle or something. Go see the doctor. See the doctor. I know some people have a lack of comfort with doctors and whether or not they know what they're doing. They do. Some better than others. Some
like
EMS
everything
people
else.
Better than others, right?
Right.
But make that phone call, dial 911, get yourself taken care of, and that's the most important takeaway from this, Tom. Is that fortunately, I had the presence of mind to do the right thing. It took a little Siri to convince me finally that the thing that I needed to do was to call 911. And hats off to Apple for not indulging my need to know all the details before I made that call. On the second time I asked Siri about that, it was clear to me, okay, this is what I need to do. And so I did it. So thank you, Apple. I will say I did get a notice on my phone about hypertension, on my watch about hypertension after the fact, after I'd been in the hospital.
Right.
But that was delayed, and that's more of a, hey, you should maybe check with your doctor.
Right. So I think that's how they have that designed, as hey, there's a trend here. You had sent me a screenshot from Gentler Streak.
Yeah.
With the recovery stuff in it.
Yeah.
And it was clear, where things went off the cliff there.
Oh, yeah.
So have you looked at, how's that trending now? I'm just curious, as you're 6 weeks out, like what that shows.
So it's interesting. And I sent a message to the folks at Gentler Streak, and I will say thank you guys for responding so quickly. Responded the next day. I said, hey, do I need to let Gentler Streak know that I had a stroke? Was there a way to do that? And they apologized for my stroke. Very sweet of you. And then they said that the algorithm will pick that up. And it did. So, but if you look at it, you can see there's a line. There's no way for us to really post screenshots in the show notes. Maybe you could do it in your newsletter.
I can. I could do that.
Yeah, we could post it in the newsletter so you can see. But there's a clear drop off. I was hiking, playing soccer, doing all that kind of stuff, and it drops down to less than zero. Like it goes, and the beauty of Gentler Streak is it kind of gives you parameters of where you should be generally. So rather than, you need to do, get your heart rate up to 10,000 today. And then, it tries to keep you in this band of color, and will tell you when you pushed too hard. And then we'll tell you when you're, and you'll see that it's slow trend upwards, but it's still not, it's not what it was prior to my stroke. And I will also tell you, when I was in physical therapy and occupational therapy in acute rehab, which, by the way, acute rehab, frigging genius. I'm going to shout out to the whole staff and everyone at Northern Duchess Hospital's acute rehab. Brilliant work. You did amazing work, made it fun, and really worked my butt. But the gentler streak was like, whoa, back off, dude. You've been like, like now you're pushing too hard. Because you could see they were working me for 3 hours a day. Mm-hmm. I was doing 3 hours of initially vocal therapy for 45 minutes and then PT and OT for the other hour and a half.
Right, in a very run-down state at that point, too. Like, been through the ringer. So
yeah, I mean, before I got there, I couldn't stand up. And by the time I left, I could walk unencumbered, no walker or anything. So 2 weeks.
That's great.
Some of that, and this is another note to all you who are listening. Fortunately, I was/am pretty fit, because I lose a couple pounds like probably most of us. But other than that, hiking every weekend, my job at the bar, hustling my butt off, always, basically running, the whole time I was managing the bar. Being fit, taking care of your body now will benefit you greatly in the event that you do have some kind of medical event. It doesn't mean you have to be crazy. You don't have to be Tom pumping iron in your garage. It doesn't have to be that. But just making sure that you're, on your feet, not sitting in front of the television, not eating potato chips all day or whatever it is that you're doing, that you're taking care of your body. It will go. I think a lot of my current state of recovery, which I think is fantastic, I still have many deficits, and it's going to be a while before I'm back to myself. But a lot of that, I will say a lot of that has to do with the fact that I was taking care of my body beforehand.
Yes, 100%.
And that's a huge bit. It doesn't need to be a lot, Go for a walk every day. Just keep your body in a spot where it's able to basically leverage your healthy lifestyle. Mm-hmm. So that's that. So there you go. Lots of details. And I'm very grateful for where I'm at. Like I said, I still have a lot of recovery. I will not be able to go back to work at least until January, and maybe later than that. It just depends on what's going on. So just a reminder, there is a GoFundMe out there if anybody wants to assist in making sure that I still have a roof over my head when I start back to work. But overall, super grateful for where I am. Could have been much, much worse. In fact, one of the doctors who first came in to see me when I was in acute rehab, knowing that I had Wallenberg syndrome, walked in and goes, "Oh, I was expecting you to be far worse than you are."
Good.
So I'm really grateful that I'm where I'm at, and I can laugh about it, which is also huge.
Yes. Yeah, and I can't imagine how terrifying that whole event was.
Stupid to have recognized the terror of it, but yeah.
Right. And for you, for Kathy, everybody else, and yeah. And I'm just thankful you're here.
Same.
Here today, of course, and that it was no worse, because those things can turn quickly. I had a family member probably 15, 20 years ago who had that. She was my grandmother's sister, and she was in her 70s, but she lived by herself, had it, laid on the floor for 2 days before anybody knew.
Crazy.
So terrifying, and it's so I keep trying to get my parents to wear their Apple Watches, because it's like, hello, but they're they don't want to hear from me. So,
well, maybe after they listen to this podcast,
right? Well, that's what I told them. Yeah, but and that's why I'm such a big proponent of the watch in general, because it collects so much data, and the more sensors they can add to it to collect even more data, I'm all for. Because you never know when you're going to need it. It's like I'd rather have the data and not need it, as they say. But
correct.
But yeah, so very thankful to that you're making progress, and yeah, scary.
Yeah, definitely much better than I was 6 weeks ago. 6 weeks ago? In my speech suddenly went back.
Let's not overdo it, Jeff. Wrap it up. Take us home, buddy.
All right. Well, as
we did
always,
all that up front. So.
Yeah, right. Just a reminder, feedback at basicafshow.com. We'd actually be interested to hear, any of you that maybe have had medical issues or have ongoing medical issues. Let us know. And we can empathize, and we're interested. And most of all, pay attention to yourselves.
Yes.
That's the kind of the big thing. Feedback.
Yep, get your checkups, all that stuff. Talk to your doctor as much as you need to. I mean, it's easier than ever now with these portals. Send them an email. Hey, totally. Come in. That kind of stuff.
Huge. All huge. Tom, thanks. Thanks for letting me talk about this.
No, thanks for sharing this. I think it's important. I know it's a little, off our usual thing, but it's important stuff to share. And it was a personal story. I mean, we're very good friends at this point. So
what? No, Tom, come on. Don't overstate that.
Basically, we yell at each other sometimes. You kidding me? You dumb. We'll bleep the rest out. That's how you know somebody cares.
Right.
If you can't talk trash to one another.
Correct.
So, but yeah, thanks for sharing it. I do think it is important to do that. So
yeah, and I'm happy to be back.
Yes, very happy to have you back.
Definitely grateful.
Yep.
In every sense to be able to be here.
Yeah. So we've got a couple of shows coming up before, by the way, happy Thanksgiving this week. If you're in the U.S., forgot that at the open. We are in Thanksgiving week. So if you're part of that, I hope you enjoy. Safe travels. After that, we've got a couple of shows coming up in December. Joe Moyer's coming back on one of those. We're trying to pin down exactly which one. One of those is going to be what's become our annual favorite things of the year, Jeff. So we'll dig into that. I need to start.
My favorite thing is I'm alive.
That's going to be top of the list. Yes. So you'll be that. That's it. One and done. I'm out.
Yeah.
And so I think he's coming on for that one. So that'll be probably right there before Christmas time. But other than that, that's it for this episode. Thank you everybody for being here. We'll talk to you again in a couple of weeks. Until then, enjoy life, pay attention to your health, and we'll talk to you next time.
See ya.
I don't want to know about your imperfections, dude. Prefer to leave you on a